Hi everybody, my name is Sarah Jane Brewer and I am an education specialist with United Against Human Trafficking. So today I wanted to address all of our wonderful, brave healthcare providers out there about how your role as a healthcare provider might intersect with human trafficking. So frequently, situations of trafficking have very dangerous and violent situations that are inherent. Maybe there are drugs present, maybe there are weapons present, maybe somebody is involved in the commercial sex trade, and as a result, their body goes through a lot of trauma. There are myriad reasons why somebody might experience physical, mental, and psychological ailments in the context of their trafficking situation. So studies have shown us that about 65 to 88% of victims of trafficking have encountered the healthcare system at some point during their exploitation, but only 6% of healthcare providers report treating somebody who is a victim of trafficking. So this data can tell us that healthcare providers might have the highest likelihood of encountering someone who is being trafficked, but they don't necessarily have a lot of confidence in identifying somebody who has been trafficked and providing them with that support that they need. Survivors have also told us that they have felt judged or have felt a lack of compassion from their healthcare providers, and that has dissuaded them from trusting that provider with telling them fully what's going on with them. So we all have prejudices, we all have biases, and sometimes when we see someone in a certain situation, we might make assumptions about their situation. And for somebody who has been trafficked, they might experience that at a higher rate. So if you are seeing a patient who triggers these biases about who they are and where they come from, and you just try not to allow that to indicate how you provide care for that person. So as a nurse, doctor, administrator, a technician, or any other role in the healthcare system, you have an immense power to intervene, connect that person with services, and you might be the reason that they are able to leave a life of exploitation. You might be the greatest chance that somebody has to receive the support that they need. So, what can you do to fight human trafficking as a healthcare provider? Recognize red flags. Separate that person from their trafficker. If that person does not speak English, try to use a neutral translator to find out what's really going on with this person's story. Talk to your patient about what options are available to them and empower them to make decisions about their health, their well-being, and their life. If you have a hospital social worker on staff, maybe get them involved so that they can help make referrals to services that are appropriate and can help that person to leave their exploitative situation. It's a great idea to create a human trafficking protocol within your organization. So we actually have a huge, extensive webinar training on your role as a healthcare provider and how you can identify those red flags, find out more about trafficking, create that protocol, and what resources are available to you as a healthcare provider to help empower you to fight human trafficking. So if you are interested in joining any of our upcoming healthcare provider webinars, you can check out our website. Thank you so much for giving me a few minutes of your time, and stay safe.